Hi, my name is Dr. Kenneth Morgan Aguilera, and I'm running for Congress in Texas' 12th Congressional District as your next congressman. But I'm here right now to talk about an important issue that's affecting millions of Americans across the US of A, and that is health care. As we know right now, the government is shut down and no one can agree or willing to agree on things that provide the basic necessities for the American people. But I have a plan, a framework of healthcare, a universal healthcare system that will work for everybody, regardless of party. It is a tiered program that has two levels to it. Now, on the basic fundamental level, the plan is 100% funded and guaranteed because we're already paying for it via our federal taxes and payroll taxes. Now, if you decide that you want to level up to a higher plan, that is also built into this process so that you can determine if you want to go with the basic level or an expanded level, which is covered at your expense, not through taxpayer dollars. Now, let's talk more about this. Under the Tier 1 Universal Base Care, coverage provides primary care, emergency service, mental health, preventative screenings, and essential prescriptions. Funded through federal income and payroll taxes with no out of pocket expenses at the point of service. Delivered through a public private hybrid network of clinics, hospitals, and providers. No deductibles, no premiums, just care when you need it. Tier 2, which is the optional premium plan. Americans can choose to upgrade to PPO plans with broader provider network access, private hospital access, elective procedures, or enhanced amenities. These plans are paid for by the individual or your employer if you so desire, but they are not subsidized by taxpayers. It maintains freedom of choice without compromising universal access for those that can afford to elevate up. Now, you can level up if you want to, but no one gets left behind in this plan or version thereof. Why this plan works. It provides fiscal clarity. Basic care is funded by taxes we already pay with no new bureaucracy. Equity and flexibility, everyone gets care, but choice remains for those who want more. Political viability avoids full government takeover while solving coverage gaps. Economic boosts, healthier workforce, lower ER costs, reduced medical bankruptcies. And finally, implementation path. Expanded existing programs like community health centers, VA, Medicare, and Medicaid infrastructures. Create a federal healthcare access card for all citizens and legal residents. And create a partnership with states to ensure to define a tiered standard of coverage. And last but not least, public education to launch this program because why? You've already paid for it. Now get what you deserve.